And a new allegedly highly contagious strain of COVID-19 is sweeping across southern England. And Canada's Minister of Health, Patty Hajdu, says she met with Prime Minister Justin Trudeau and officials from the Incident Response Group to discuss the impacts this afternoon. Meanwhile, NDP leader Jagmeet Singh says we can't afford to wait. Taking to Twitter tonight, Singh says with vaccines still very rare, if this new strain gets loose here in vulnerable populations, it will be a disaster. We need more information, but until we know more, flights from the UK need to be suspended. London, England has moved into a full-scale lockdown today in response. A number of European Union countries are imposing travel restrictions to prevent the spread of this new variant across the continent. Austria, Belgium, Germany, Italy, and the Netherlands are barring flights, and the Czech Republic is imposing a 10-day mandatory quarantine on anyone arriving in the country who spent at least 24 hours in the UK in the last 2 weeks.
The new variant is out of control and we need to bring it under control, and this news about the new variant has been an incredibly difficult end to, frankly, an awful year, and it's important for everybody to essentially act like they might have the virus.
There are mutations that are identified all the time. What is really important is that there's a process in place to understand what these variants do and how they behave.
The World Health Organization, this new variant was first spotted in the UK back in September. For more on what we know about the UK's new coronavirus variant, Dr. Zain Chagla joins us, an infectious diseases specialist at St. Joseph's Hospital here in Hamilton. Dr. Chagla, we're learning that the variant could be 70% more transmissible, but is it more lethal or could it cause more severe illness?
So no, this is really referring to the rate of spread. Viruses, when they evolve, try to spread to be more contagious. They don't necessarily want to spread to be more lethal. If anything, that is a disadvantage to the virus. They want to infect more individuals. And so what we're seeing here is more of this variant showing up, particularly in Southeast England. It is being associated with a significant amount of transmission being seen in Southeast England, and we're seeing London go into lockdown right now. And part of it may be responsible for some of the spread. That being said, it is a thought. There may be other factors, including genetics and population, that could be playing a role, but there potentially could be a part of this virus that is leading to more spread in England.
And we've seen other countries, though, shut down travel from the UK. Do you believe this is something that Canada should do?
The European Union has decided to shut its borders to the UK out of an abundance of caution. I think for us in Canada, we could take that road, or we could just make sure that we are really quarantining our travelers, making sure that they are staying indoors and making sure that they're adhering to the public health precautions. Really, at that point, if they can do that appropriately, then, the risk is mitigated as much as it can be.
Right, because at this point, we still do have that 14-day quarantine period that people must do if they arrive in Canada. One question that a lot of people have is what impact could or will this variant have on the vaccine?
Yeah, absolutely. I think that's the biggest question for everyone. So some of the mutations do involve the spike protein, which is the target of our vaccine. That being said, it is a very small region of the spike protein, and the way our body acts to make these antibodies from the vaccine is to different pieces of the spike protein. It's not one piece altogether. And so I think most of us can be reassured that the vaccine is still an effective strategy moving forward. Also remember that this is only being described in about 20% of the cases in Southeast England, and so there is a significant amount of regular COVID around in that sense. And remember, viruses do mutate along with the stresses we're given in terms of interventions, masking, and the vaccine potentially eventually. But we really haven't gotten that much vaccine out there. And so really that hasn't put enough pressure on the virus to start moving against it.
I do want to focus on a bit of a positive note right here in Hamilton. We heard last week that the city will be getting the vaccine soon. Do you happen to have any more insight or who will be the first vaccinated here in the city of Hamilton?
I think we are going to go by the Ontario framework, which is really, going by those 4 priority groups, particularly those in long-term care, those working in long-term care, and those healthcare workers, particularly those ones that have to deal with COVID or at risk of COVID. It will be at Hamilton Health Sciences, as was reported, and I think obviously it's great news across the entire Ontario region. Many people are talking about the same story, and even in this week, we talked about 8,000 vaccines being given across the country. So hopefully we'll be joining those numbers soon.
Dr. Zain Chagla, in case we don't connect throughout the week, happy holidays to you and your family, and thank you for all you do for our community.
No worries. All the best.